there, my name is Laura and I'm going to be talking with everyone today about breast engorgement, especially with twins. I'm going to start off by talking about what breast engorgement is, what it looks like, and I'll go over some techniques about what we can do to resolve breast engorgement. What is breast engorgement? Breast engorgement is a normal physiological condition experienced by most women after they give birth, usually about 3 to 5 days postpartum. But it can also happen anytime during lactation, and this is due to retention of the milk in the breasts. So when a woman gives birth, her progesterone and estrogen levels fall, and this causes prolactin to be released from the anterior pituitary, which is responsible for synthesizing and secreting milk from the breasts. So breast engorgement is characterized by the painful swelling of the breasts due to this sudden increase in milk volume in the breasts. Now, most women, like I said before, experience some degree of breast engorgement, which is normal. However, when breast engorgement becomes moderate to severe, it is more of a concern at this point. What is the pathophysiology of breast engorgement? So when a mother gives birth, she releases the hormone prolactin, which causes her to have an increase in milk production. Now, the volume of milk in her breast has exceeded the capacity of the alveoli to store it, and overdistension of the alveoli may occur, possibly causing milk-secreting cells to rupture. This overdistension that occurs in the alveoli can also partially or completely occlude the capillaries surrounding it and further decrease cellular activity, causing milk to not be secreted. Capillaries also become congested due to an increase in blood flow to the breasts, and this fluid may leak into the surrounding tissue, causing the breasts to swell. Congestion may also obstruct lymphatic drainage of the breast, which is responsible for removing toxins and bacteria. And if this drainage, if the toxins and bacteria cannot be removed from the breast, this predisposes the breast to infection, which is known as mastitis. Some factors and causes for breast engorgement, especially with mothers with twins, are they have a higher rate of milk synthesis. Therefore, they're producing more milk than a mother who would have a singleton baby. So if their infants are consuming less or they're pumping less, then milk volume will exceed milk removal and cause breast engorgement. Twins tend to also be preterm babies, so some factors for breast engorgement due to that are preterm babies tend to be separated from their mothers, and this can also cause a delay in initial feeding. It can cause the baby to have supplements and also infrequent feedings as well. This also limits skin-to-skin contact because they're separated from their mother. And babies that are preterm infants are also have smaller mouths that aren't fully developed yet, which can cause an improper latch. And this can also delay breastfeeding and cause engorgement. Other factors included are sore nipples, and this will also cause the mother to not want to feed, which causes less milk removal, and small breast size, which has a smaller storage capacity for milk, causing breast engorgement. And women that have had previous breastfeeding experience, they tend to engorge sooner, but they also tend to resolve engorgement faster. Some signs and symptoms of breast engorgement include firm, tender, swollen breasts that are usually painful, and the breast may feel warm or hot. If the breasts are very swollen or you have extreme severe engorgement, then the skin of the breast may kind of look, here's my little breast, the skin may look shiny and red, just like this. And the tenderness and swelling may also extend up into the armpit, kind of in this area. So when treating, when you're going to use cold packs, you need to make sure that you put them up here as well. The areola will feel firm and the nipple will possibly appear flat. And this can cause the baby to have problems with latching on, but the flatness of the nipple is due to the swelling of the breast tissue. So if milk is not removed, then the milk supply may diminish. The 3 priorities we want to consider when dealing with breastfeeding challenges are: number 1, feed the infant. We want to make sure that the baby is getting as much milk as he or she needs, or as much milk as they need, as in twins. Number 2, move the milk. We want to make sure that the milk is being effectively produced and stimulated to be removed from the breast. And number 3, help the dyad. We want to make sure that both mom and baby learn how to breastfeed and that the relationship between mother and baby is working and there's an effective latch and milk is being removed and everything is going well. So for treatment of engorgement, you'll want to begin treatment soon after you experience signs and symptoms of engorgement, and then engorgement should resolve within 24 hours. If you take no relief measures, then your engorgement could last up to day 10 postpartum, and this is due to your hormones readjusting. So by this point, your body will have resolved the engorgement on its own. To relieve any pain or discomfort, you can take ibuprofen, an anti-inflammatory. Talk to your healthcare provider beforehand, but this will help with swelling and pain. You're going to want to increase the amount of times you feed your babies. So you want to feed them every 1 to 2 hours and make sure that they have an effective latch. Before feeds, you're welcome to use a warm compress to help stimulate your breast milk. However, you don't want to use a warm compress any other time as it can increase swelling, but I suggest taking a diaper and filling it with warm shower water and placing it on your breast for about 3 to 5 minutes before you feed, and this will help stimulate the flow for feeding and expression and or pumping. So while you're feeding, you can also massage your breast to stimulate the flow. In between feeds, you're going to want to use cold compresses to help with your discomfort, and these include either ice packs or a bag of frozen peas, or you can purchase a bra that has gel inserts that you can stick into the freezer and then stick into your bra. And you're going to want to use your cold compresses for about 10 to 20 minutes and then off for 10 to 20 minutes, and then you can put your cold compress back on for 10 to 20 minutes. Cabbage leaves are also very helpful. However, you don't want to overuse the cabbage leaves. You want to use them for a maximum 20 minutes 3 times per day. But what you do is you take a cabbage leaf and you're going to take it off the cabbage and pop it into the freezer. And then you're going to take it out and you're going to pop it into your breast like so, or into your bra, and place it in there and leave it in for about 20 minutes max, or until the leaf starts to wilt, and then you can take another one out of the freezer and place it on your breast, but make sure you get right up to your armpit if that's where some of your engorgement is as well. but you don't want to overuse them as it can dry up your breasts and stop milk production. Make sure you get lots of rest, lots of fluids, and wear a well-fitted supportive bra, one that's not too tight. If your engorgement doesn't go away or get resolved, you can call a lactation consultant if you're not getting any relief, and if your breasts develop any sore spots. And if you experience a fever, then you should call your healthcare provider. I hope all this information has helped, and it was nice teaching and informing all of you, and thank you very much.